Good afternoon, Rachel and Rebecca. Can you hear me okay?
Yeah, I can.
Thank you, Rebecca. Rachel?
Sorry, yes, I had an issue with my camera.
Oh, okay, great.
Oops. Oh,
Can you hear
that's
us?
why it's on the wrong camera. Okay.
And you can hear us okay?
I can.
Okay. I think our chair is ready to start. We're at quorum.
Are you guys talking? Because I can't hear anything.
Not yet. We haven't started yet. The Chair Benton will
Okay.
start us in right at 6 o'clock. We've got
I'm sitting here
one.
going, what's
Yeah,
going on?
we have 1 minute to go.
Okay.
All right. Well, that minute went by really fast. It is officially 6 o'clock by my time. June 21st, 2023. I'm going to call to order the meeting of the Council on the Family Resource Centers. Rochelle, do you mind doing roll call?
Vanessa Van Cor. Rachel Kingham. Go ahead.
Here, sorry.
That's okay. Scott Benton.
Present.
Rebecca Paris.
I'm here.
Sherilyn Elcano.
Here.
And Susan Seaver.
She will not be joining us tonight.
We're at quorum, Chair.
Thank you. With that, we'll move into item 2, which are items for presentation, discussion, information, and action. Public comments from the public are invited on items for possible action. A public comment card should be filled out and submitted to the recording secretary before speaking during public comment section. With that, we'll go to item 2.01, which is approval of the minutes of the March 15th, 2023 meeting of the Council on Family Resource Centers. This is for possible action. And our wonderful Lisa sent these out to us over email, but were you guys able to review them? Or should we pull them up?
Chair Benton, can I go back just a moment? We do have 2 public comments.
For,
Item 2.
so according to the agenda, they're only able to make, under item 2, I'm looking for counsel that we can't take public comment as a
Until
general
the-
public comment,
Okay,
only on the action items.
got it. Thank you.
And at the end, we have the ability
Okay,
to
perfect.
make public comment. Back to the council, is there any changes or updates that need to be made to the minutes of the March 15th meeting? If not, I will
No.
look for any public comment on this item 2.01. Hearing none, to the council, if there is a motion, I would love to entertain one.
This is Rebecca for the record. I motion to approve the minutes.
Thank you, Rebecca. Is there a second?
Yes, this is Sherry Elcano, and I will second that
Thank you, Sherry.
motion.
Hearing the motion and the second, is there any discussion? Hearing none, all those in favor, please signify by saying aye. Aye.
I,
Aye.
Any opposed? All right, motion carries. Item 2.02 is a presentation and discussion of the Washoe County School District Family Resource Center's funding status, including the status of grant applications and possible action to provide recommendations to staff on scheduling future fundraising and publicity activities. This is also for possible action. I will open the conversation up. This is something that I've asked for to be on every agenda item. Knowing what we have learned at our March meeting, I would be looking for some updates from Michelle, but also entertaining this motion to table it so that we can talk about the fundraising goals when we have a full council. I don't think it's fair right now for the 4 of us to make any recommendations. But with that, I'll let Michelle speak.
Okay, good evening, Rochelle Murillo for the record. Glad to see everybody's faces. I know some of you couldn't make it in person, and so I'm glad you were able to join us virtually. We are just about done and have been awarded our final award most recently this week for Title 4B. We applied regularly. We apply to our Funds for Healthy Nevada grant, which we did get. We got our Title 4B grant, which we were funded at, not fully at what we requested, but we were funded, I believe, Lisa said 94% in one area and 79% in the other. We are a part of a grant that we're calling Cortez Masto. We did receive $98,000 through Human Services Agency that recognizes the need for us to have staff, in particular at the Feemster Family Resource Center. So it's funding 2 of our family advocates, which we're excited about. It doesn't fund the entirety of the salaries and benefits for those 2 family advocates, but the vast majority of it is funded through that particular grant. We did receive the Children's Trust Fund. That's a grant that allows staff to provide parenting to families to prevent child abuse and neglect. And so they do that in a variety of ways through an evidence-based curriculum called Parents as Teachers, and some other larger group classes that they do through Step 2 and some other areas. So they were awarded that grant as well. So we did get all of the grants that we wrote, not all of them fully, but we did get all of those. And then we do get some reimbursements for assisting clients filling out SNAP applications. So we do have some of that as well. We've been in grant season recently, doing budgets, revisions, making sure that all of our staff are adequately funded, and in our human resources department, so that we've got payroll set up. So we are fully funded next year for all of the current staff that we have.
Thank you.
awesome.
Any questions for Rochelle from the council?
No.
Rochelle, I know I ask every time, what is the funding gap? I hear that we're fully funded for the next year, so are we planning for, so it's a two-part question. What is our
Yeah.
funding gap? And then also, what are we looking at for FY '24?
Okay, so I'm not sure yet for FY24. What I will say is ideally we need two full-time family advocates at each center. We have 5 centers now. We have one at the Feimster Family Resource Center. We have a half-time person at the Worcester Family Resource Center. We have 2 over at Sparks, and we've got 2, but those at Desert Skies, but those 2 are also dedicated to go out and do parenting. So when staff are polled, because we often frequently want to go out and meet families where they're at, they can't always come to our centers. That's not always possible. We need to go to them sometimes. If we're moving staff to go meet families, then we don't have staff at the center to meet the needs of folks that are coming in. Also, at a site like O'Brien, and I didn't talk about that, O'Brien has 1 family advocate. They have been incredibly busy at that center. Jesse shared with me every Friday they have about 80 families accessing their food pantry. Obviously, having 2 people there and trying to distribute food to 80 families is incredibly difficult. So we need more staff to meet the needs of the community that we're serving. So I hope that makes sense. We just need more family advocates so that we can respond to the need, answer the phones, fill out the SNAP applications, the Medicaid applications, respond when at 5 o'clock on a Friday a family is saying, I have no place to go tonight. I'm going to be living in my car, and you know that, Chair Benton, that happens. And so we need to be able to respond to that need. And so it's staffing, it's more family advocates.
So for what I'm hearing, 3 more family advocates?
Correct.
Did I do math correctly?
Yes, and we are also partnering, as we do every year, with the University of Nevada School of Social Work. And we recently interviewed interns, both BSWs and MSWs. We're hopeful that we can get some interns. Those are about 15 hours a week. But every bit of that helps out, and it's a good learning opportunity for interns too when they're going through their social work program.
That's great for everybody. Win-win.
Yes. So hearing that there's the gap in staffing, I should know the answer to this. ARPA funds expire or exhaust. We had to exhaust them already?
Not the ones through Family Resource Center. Sorry, I have some that are in another program. Family Resource Center, and our last one grant that we had, the CDC grant, ended on May 30th of this year.
Okay.
And we did have 2 staff in that grant, and we lost those 2 staff.
Okay.
And sorry, Scott, this is Rachel. Just to clarify, so those 3 staff are for this coming school year or only as of January 2024?
No, we need them right now. So that's an immediate need right now that we don't have. So we are fully funded for our current staff that we have at the Family Resource Centers. Ideally, and I'm trying to present, ideally, it would be nice to have 2 family advocates that allows the Family Resource Center specialists who coordinate day to day to also be involved in other programming that helps support families and partner with and bring in other community partners where we can co-locate services like WIC, Catholic Charities, SNAP Outreach. They need to have time away from the center to build those relationships and coordinate those efforts to co-locate services as well. And then family advocates can go out if they need to reach families when needed. And when it's just busy, just keeping up with things like food pantries or when we have a closed closet or those kinds of things.
Okay. Well, I think it's fair as a council, you guys know that I advocate, what is the meeting I go to, Lisa? The stakeholders for the ESSER funds, and I meet with Laura and, is it Lauren? Laura. the director of the grants, and she hears all the time from me that the money all needs to be poured into the family resource centers. However, there's not money to pour in there, so we can't squeeze a dead lemon to make lemonade. And so I think the agenda item for us is really to see what we can be as a council creative in funding. So if you guys hear of grant opportunities, please forward them. Lisa loves to get those emails from me. But really keep your eyes out, ears open for some funding opportunities that could fill some of those funding gaps for the council, for the centers. Being that it's an action item, I'm going to look to the council to see if there's any action you guys would like to take. If not, we can move on to item 2.03.
And may I clarify, Chair Benton, this is an action item. It will continue to be an action item on our agenda as we've discussed frequently different ideas around fundraising or other kinds of things. We wanted that opportunity for the committee to discuss and take action if wanted.
Thank you.
I have something. This is Rebecca for the record. So when we're talking about fundraising, you know, we have been talking for a while about this. When do we want to action, like, are we thinking about doing an event? And, like, when would we want to do that? Is there, like, a time frame we have or something?
So I think we have always talked about having an event to raise money and awareness of the resource centers. I don't think we've ever said this is when we want to do, what we want to do, and that's why that item stays on the agenda so that if we want to formalize something, we can. I know we talked at our last meeting about doing something in conjunction with Family Resource Center Day, which was in May. So I think if we continue to have the conversation in September at our next meeting, we can solidify something because we only meet 4 times a year. So for us to have made a decision back in March, it would have been a fast decision, and that would not allow this Family Resource Center staff enough time to properly plan for this. And I think that's where we're struggling is we as a council can't plan it. We have to give direction to the staff to plan it. So we would look at Rochelle and her team to plan that, and that would be a heavy lift, or would have been a heavy lift for 6 weeks, 8 weeks to plan a big event. So I think as a council, we have all agreed that we want the event to be successful and whatever that looks like. And if I remember back at our last discussion, we were talking about who's the target audience for a fundraiser. Is it the people that are utilizing the family resource centers, or is it other communities outside of those zones? For Sparks High School, O'Brien, do we want to target where there isn't a family resource center so that people understand within the school district there is this need, but there's also these centers to help the need be met? If I remember the conversation correctly. So I think you're absolutely right, Rebecca. Like, what do we want to plan? And we can certainly have that conversation. It's agendized to do so. But I think we were onto something as a council, that we host an event at one of the family resource centers, and we do it in conjunction with something that's already happening, so the staff isn't having to plan something twice. And I know I will look at Brenda, who is in the audience with us today. She had a very successful event at Hug that I was, well, maybe it wasn't her event, maybe it was her and Lisa together, because I saw both of them there. Oh, it was not even them, it was Yesenia. So I was able to attend. They had a family resource, or a resource fair, and a bunch of community partners were there. So something like that I think would be ideal, so that, one, the community partners can be there to support our fundraising efforts, and they can invite people that they may know, but also as a council we can get behind it and support that event, which I think was a successful event. I'm hoping that we'll hear about it later on a different agenda item. But something like that is, I think, where we as a council were going. Does that answer your question, Rebecca? Very long-winded answer.
Yes, thank you.
Thank you for the question. Any other questions? All right. Hearing no questions and no motion, we will close item 2.02 and move to item 2.03, which is presentation and discussion of the Washoe County School District Family Resource Center 2022-2023 school year data and outreach events, including future community outreach events and volunteer opportunities. This is for presentation and discussion only, and I'm going to invite up Mr. Wiley.
Good evening, board members, Chair Benton, that Wiley Evanson for the record, will present on the FRC data that we have for the year. So I'm hoping Rochelle got that pulled up. Can you guys see it via Zoom? All right, I'll wait till we have that pulled up.
I was able to, and then it disappeared. I don't know if that was for everyone.
I'm trying to
I
bring
don't-
it up
yeah.
so there's a bigger version for you. So hang tight while I deal with technical issues.
Can you hear me?
Yes, we can hear you.
Well, I don't have the ability, for some reason, I'm kind of up on my screen, this little tiny corner, and there's no mute button, and I like to keep it muted in case I sneeze or something like that. And I can't find the mute button in this particular format.
I'll try to mute you.
All right, thank you.
Can you all see this now?
Yes.
All right, so since you all can see this, I'll just quickly go over it. So this is July 1, 22 to May 31st, 23. So this is kind of a look at the year to date, excluding this month. Over that time, we've helped around 2,500 families, 2,489 families, 2,600 children, and around 3,700 individuals. So, and that the families consist of the entire family unit. We just track the children, so you guys could see that, and then the individuals is everyone. So that's adults, seniors, and all of that. You can kind of see on here the utility assistance and EAP applications were extremely high. We had a lot of people seeking assistance through our SAFE program, which is the emergency assistance. And then when that program, we exhausted that funding, and we started referring to the energy assistance program through the state of Nevada. And so we've been double digits in that, and those applications submit every month for each of the centers. So we're submitting quite a few applications for the EAP program to try to get our families the utility assistance. And do you want me to pause?
I'm trying to bring it up on this screen. They can see it online, but I can't pull it up to this screen.
All right, we'll pause while we get that back up.
There, let's just use this one. Okay, go for it, Bailey. Okay.
All right, so hopefully that's back up and you guys could see that. As I was saying, we had a lot of utility applications, so you could see that number is fairly high. With the Food Bank of Northern Nevada outreach sites at O'Brien, FRC, and as well as Sun Valley FRC, our food and nutrition is really high. We're assisting a lot of families with getting those that food pantry that they have at O'Brien, as well as the mobile food harvest. And then we also had additional funds through our grants this fiscal year to purchase basic needs food items. And so every center got around I would say $1,000, $1,500 to spend in food in order to create little small food boxes as emergency food to have on site to hand out to families when they come into our office or if they need it for any reason. So we were able to get lots of food and nutrition services out to our families. So that looks pretty high. We also, as you can see, the wellness, the hygiene, gift cards, clothing vouchers, that one's a little bit high because of that ability to have some funding to pay for those items to give out to our families. And Applications, we've really been working to submit a lot of those applications for SNAP, Medicaid, TANF. We just met with our Department of Welfare and Supportive Services in the state of Nevada partners the other day to do a review with them and to see about some training and trying to get our applications, our approval rate up is what they said. I think it's up 20%, if I'm correct, I think is what they told us. So our approval rate is up, but we're still trying to get a lot of our families that assistance that they definitely need. And we're hoping that next year, I apologize, this is all I have for you guys. It's not more robust. We've been in the middle of writing grants and budgets and revisions. So I'm hoping to have some more data around CallRail and what potentially we could have with our budgets and funding for the next fiscal year as well.
I'm going to put you on the spot, Wiley.
Yeah.
For the applications that we submit for, or you submit for SNAP, what is is it a flat rate that we get? And then also, can you tell us what the rate is for the applications for the NV Energy Assistance Program that we are, I don't want to say reimbursed, but we're given?
So the SNAP applications is based on the amount of time that we spend with the client. We get reimbursed for the time that's spent on those applications. So all of our advocates, all of our family resource specialists submit time logs for that, and we track all of that time that we're spending on SNAP, and then we're reimbursed for that time that we're spending with them. So anything, if we're actually doing the application, working with them, talking with them about SNAP, we get reimbursed for that. And I don't think there's like a flat rate. I don't know exactly the parameters around that. I'd have to refer to Lisa. Lisa knows a little bit more about SNAP. There's not a flat rate. Thank you, Lisa. And then we get reimbursed on the utility assistance applications. I think I have to refer to Brenda for the SAFE. We get reimbursed $15 for each SAFE application that we submit, and I believe it's $10 for every EAP application that we submit. So that goes into we have a budget account. Huh?
Yeah, the EAP is double the work.
Yeah, it is pretty extensive, the application that is needed. SAFE is a pretty clear-cut application process. You just got to call in, and we determine your eligibility and work with NV Energy to get that credit applied to your account. With EAP, you have to submit an application with rental verification, citizenship, income, lots of other documents that are needed for that application, and it takes 60 to 90 days is what they tell the client that it takes. But right now, I think last time we checked, they're still working on applications from February. So it's taking a little bit longer. They're only at 75% capacity running that program. So we're really trying to get our families that assistance, but it is pretty difficult to get them that assistance because it is such a lengthy process and it does take so long, especially if they are disconnected. They don't have the time to wait 60 to 90 days to try to get that application in, submitted, and reviewed and approved.
Wow. Not that I want an answer right now, but when it says utility assistance and EEP applications, hearing that there's a different dollar amount being reimbursed, is it possible maybe at a future meeting to get that separated so that we can see those numbers separate?
Yeah, absolutely. So like what we're actually getting reimbursed is what
No,
you're
I
looking
just
for?
want to see how many are going for utility assistance and how many are going for EAP assistance.
I'll see what I'm separated out. Yeah, absolutely. I can do that because we track all that applications, and separately I just put them together to hope, because it's a little bit difficult to kind of see them, and it's a little bit better if they're together. But
and more so just for my knowledge, and you can certainly email me if that's more appropriate. I just want to, the work that you guys are doing, hearing that it's double the work for the EAP program, so that when we're out talking to people, we can say these are the applications we're processing and we're being reimbursed little, but we're spending 60 to 90 minutes 3 times a week on just this one person's application. I think that would speak volumes rather than the SAFE program where it's an easy, fast 15, 20-minute process when we're getting reimbursed $15 for that.
yeah, and our database, I know you guys I've talked a lot about it through eLogic. They've implemented a couple new features that we're able to track the time that we're spending with clients. So we're able to see how long that we're actually spending with clients, and then the cost amount, the dollar amount that is going to each client, that we're actually direct service that we're providing to them. So I'm hoping to present a little bit more on that to give you guys some more additional information about how much time we're average that we're spending with our families and our clients for each advocate, and then about how much is costing in order to kind of move them from crisis into stability. So you guys can have a little bit more information about that as well. It's just a new feature that they started to implement for us.
Awesome. And because I have such a captive audience here with me, can you give me a rough number about what you think each person that walks through the Family Resource Center is costing to go from crisis to stability?
I don't know right off the top. I mean, I can go back and look at some of our clients that we've worked with extensively on eLogic and maybe come back with an answer for you. I don't know that right off looking at.
I'm sorry for putting you on the spot.
No. We have, like I said, it's a new feature that we're implementing and being able to track a lot of that. We could go back in our case files and do that before, but now our new database actually tracks all that for us, so we could see what it's actually taking. And it would depend on one family might come in and they may need all of the resources. They may need utility assistance. They may need emergency food. They may need emergency shelter. And so that would be, the cost to that family would be a lot higher than somebody who just came in just for utility assistance. So I don't know what the average would be. I'd have to kind of do some research on that and kind of look at that and see what that would look like.
Awesome.
Chairman, I can give you a little context. So there was a family that one of the Family Resource Centers was working with that was about to get evicted. But if they paid their utility bill or it was the garbage bill, I don't remember, then they would avoid eviction. But it was an entire year of that service. So we supported that bill so that the family would not be displaced. So in those cases, it just kind of depends on what is happening. So it's a little bit hard to quantify, but I think we can definitely give you sort of an idea of what that looks like.
And I think those stories are probably the most important to hear, that no matter how many referrals or resources that we provide them, saving somebody their living situation by making something happen is really the message that we want to send to the community about the work that we do.
And I can give you one more story if I may.
Absolutely.
We have been working with a single mom with 3 children, living in a weekly motel. We helped her to stay there for 1 month. And during that time, she was able to save up money to put down a deposit on an apartment. And she moved in last weekend into her new apartment with her 3 children. And she just needed those 4 weeks to just save that money so that she could get into the apartment. She's now in sustainable long-term housing.
Awesome. Good job. All right, back to you, Wiley.
Oh, I'm sorry. It's Rachel.
Hi, Rachel. Sorry, I can't see you. I have this.
Hi. Quick question. With those stories, is there a way to collect those internally? And I'm sort of putting on my very old dusty marketing cap. But I'm wondering if there's a way to collect those and maybe use them as vignettes, not to
Are you there? All right. We are going to take a break, and we will return when we have quorum. We're going to take a recess, so we're all going to meet at the playground.
I texted Rochelle. She said they're. Oh, there we go.
Oh, okay.
Apologies, that was my
There we go.
fault.
Okay.
We recessed. I'm sorry, that was my fault.
I will bring the meeting back to order, and I'm going to toss it right back over to you, Rebecca. No, was it
That
Rachel?
was Rachel talking.
Rachel.
Actually, it was Rachel.
Rachel.
Yep. Sorry. So my question was whether we could collect these in even just a simple Word document, just these types of vignettes about the different families that that the Family Resource Centers are impacting. Not to, sort of take advantage of their stories, but to just kind of provide to funders. I don't know if that's possible or appropriate.
So this is Rochelle for the record. Yeah, it is, and we do that now. So we do have one grant that asks for just a few examples of some of the work that we're doing, so they have a better sense of what does that look like and how you're serving the families with these funds. So they collect them now. And so yeah. So there's a great idea, Rachel, because we're doing it.
Yeah.
You do it. Thank you. Thanks.
Any other questions from the council? All right, back to you, Wiley.
That's all I have, unless anybody has any other questions. Happy to answer anything for this item.
No.
All right.
We can move on. Is it Jesse that's going to give us our events? Awesome. Come on up, Jesse. Slowly getting this meeting down to a science.
Hello, this is Yesenia Segura for the record. Thank you, board. And I'm going to share with you the events and the collaborations from March of this year, 2023 to the present, June. So we've done a lot. We've been very busy. We've done a lot of SNAP outreach at all sites at every five of the FRCs, thanks to the collaboration with the Food Bank of Northern Nevada, which they come once a week, every other week, and they help with the load of assisting clients to apply with SNAP and Medicaid. We also do intake sites for SAFE program and energy assistance program, like we just spoke about. We also do collaborate with Catholic charities. We do make a presence there, either food distribution at Sparks High School. We have mobile harvest come every month at Sun Valley and North Valleys. I believe Sun Valley gets them twice a month, and North Valley started there in March, once a month, the first Monday of each month. Molina collaborations and partner meetings. We also done the free laundry day with them a couple months back, and that was a great success. We had 25 families that received that assistance at a local nearby laundromat. We've also done the Health Plan of Nevada collaboration and partner meetings. They have supported us with several assistance with the plannings we have with helping our families. We've also done Silver Summit partner meetings, and I've also done the Anthem partner meetings with Anthem as well. And we've done the commercial sexual exploitation of children, the local task force meeting. Brenda also attends the Nevada Energy Safe Board meetings. We've also paid a visit to the Awaken Center. We did a tour, all the 4 specialists and the CIT coordinator. It was a really nice experience. We learned a lot of the services that they offer to all the people that do need the assistance there. We've done also the Family Health Festival, and we are part of the planning committee as well. We attended the first one on May 20th at the Neal Road Neighborhood Center. We are also part of the Nevada Immigrant Coalition. We also work very closely with the Nevada Urban Indians partners, and we do attend their meetings. The Parent Project, parenting in conjunction with the Join Together Northern Nevada and Children's Cabinet. Brenda is really close with that project. And we've also gone to the Washoe County Health District Social Determinants and Health meetings. We've done the TMCC Mental Health Disabilities Resource Center meetings. We've attended the Park on Virginia Resource Fair. We've done many collaboration meetings with Accept, MAD, Alzheimer's Association, Toys for Tots, Katie Grace Foundation, All of Us Research Program, Project 150, and Alusa. We've attended the Asian Community Development Council Health Festival. We've also gone to the UNR School of Social Work Field Fair. We had the chance to speak with new graduates of social work and talk to them about their possibilities of being interns at our centers. We had our current interns there as well and talk about their experiences and how they felt about being interns at each of our sites. We also had, like you mentioned, Chair, the free community resource fair at the Feimster Center at Hug High School. That was really great. Thank you for going there. It was really great to see you. We had many community agencies participate. They were all very eager to go. HUG also had the Multicultural Health Fair, and we also gone to the Opportunity Alliance Brown Bag Lunch. And Brenda's staff and herself attended the Nevada Housing Coalition Legislative Day. Catholic Charities Elevating Thriving Families collaboration meetings, and the ribbon cutting at the new food pantry they just opened at Moana. Washoe County Prevention Conference Intervention we've attended as well. Mental health fairs at Anderson Elementary School and Hall Elementary School. We've done the Prevention Child Abuse Conference in Las Vegas. Biggest little Easter egg hunt through the Boys and Girls Club. We've gone there as well. We also attended the Planting the Pinwheels with multiple agencies on the month of April for the Child Abuse Prevention Month. We've attended the Barks and Badges outreach at Bartley Ranch. We've gone into the Dive Into Summer event, the Sun Valley event. We've also expanded our partnership with the Food Bank of Northern Nevada. We are doing nutrition pop-up classes at the North Valley's FRC location. And as mentioned before, we do hold our food pantry weekly every Friday at North Valley's. We've also attended the CARE Solace training and attended also the Food Bank of Northern Nevada and food safety training. And we've also collaborated internally with the Washoe County School District HR's team and volunteer services team to offer a community spring career and resources fair. We also collaborated with the All of Us research program, and we did a community health awareness day this past Friday. It was really good. We had 2 sessions of those that we split during the month of May and just wrapped it up here in June. We have a few more upcoming events. We have webinars Wednesdays for the National Family Support Network. We have the Anthem Sparks Christian Fellowship Back to School event on July 15. We have the Our Town event that we can also attend on July 22nd at the Reno Public Market. And we have upcoming new family health festivals on July at Hug High School and another on October at O'Brien.
And may I add, we will have a table at the Back to School Expo on August 12th.
Any questions?
Of course, there's a question.
I'm Rachel Kingham for the record. So first of all, that's an incredible list. Thank you. One of the questions I had was, I saw Our Town up there. Is there enough staff, I guess, for any additional Art Town events, or I guess opportunities as well as staff for additional Art Town events? And the reason I ask is because of way back when doing work with art donors and such, there were a number of people who do donate to various programs, services, nonprofits that attend some of those events, and I didn't know if there were opportunities to meet some of them.
Thank you for the question, Rachel. There's a possibility. I mean, we do have limited staff, and so we would have to, if you had suggestions of ones that you think would be good good ones for us to participate, and we have the staff available to do that. We certainly can. It's just a matter of if we have staff available, if it's during the day when we're staffing an actual family resource center. Some of these events are in the evenings or weekends, so it makes it a little bit easier for us to get away from a center. So it just kind of depends. So maybe you could give us more information, and we could look to see if there was any additional ones that we could participate in.
I'll do that. I have my little Art Town book somewhere on my desk, and I'll take a look.
This is Rebecca for the record. I know that they used to do on Mondays, it was like a family, every Monday was family night. Sorry, that was the dog. I don't know if they still do that anymore, but that might be a good opportunity too, to just kind of market as well the family resource centers and what they provide.
Thank you, Rebecca.
Any other questions?
You're not getting away that easy.
Oh.
Of these magnitude and multitude of events, which one was your favorite?
I feel like the hug one was really, really nice to see the whole community come together, and how every single agency that I spoke to, before I even finished my invitation sentence, they were like, yes, we will go. And so that was really nice to see how they were all very eager to just be there and give back to the community.
Awesome. Good job with that event. Again, good job. Any
Thank
other
you.
questions from the council? Okay. Now you're off the hook.
Thank you.
Thank you. Any other presentations under that item? No. All right, we will close item 2.03 and move to item 2.04, which is the review and possible action to approve the Washoe County School District Family Resource Center Action Plan. This is also some information that was emailed out to us, and it looks like Rochelle is looking to pull it up. So while she does that, I will turn it over to Brenda Castillo and Lisa Guzman.
You didn't ask me what my favorite events were.
You weren't sitting up here for that item, and I've already closed it.
I'm going to share anyway.
It's you, not me. I
So-
can't invite that bad behavior.
So the parent project that's on our events, I've actually been teaching that. So with both Children's Cabinet and JTNN, it's 10 weeks long each one in the evenings. But seeing the parents like blossom is amazing. I also got to attend the Child Abuse Prevention Conference in Las Vegas. It's always wonderful to be in a room of like-minded people that just, the energy is always incredible. And then the intervention department attended the Washoe County Prevention Conference, which was Washoe County Human Services and JTNN. And coincidentally, that morning, our Reno mayor was on Morning Joe talking about that exact event, like youth mental health and the importance of putting dollars there. So it was really nice, again, to be in an entire conference of like-minded people. And then just
Wait a minute, you said one. I only asked for one. You've given me now 3.
and the biggest little Easter egg hunt, because it was kids and Easter, and there were 2,500
Wow.
people there. So that was
Wow.
fun. Okay, I'm done now. Now Lisa.
Thank
can
you for
speak.
sharing.
Yes.
Hello, good evening, everyone. Lisa Guzman for the record, and we are now going to cover the Family Resource Center Outreach and Action Plan. So any members who have been with us for a while may recall that this is an annual requirement of all of the Family Resource Centers statewide. However, we have not been invited or required to submit the plan since about 2019. So I have a feeling that once COVID struck, things went a little sideways, and there's been a bit of turnover at the state. So honestly, this was off my radar until, thank you, Chair Benton, for reminding me about it. So we decided to do this proactively. We do not know if it will be requested this year, and if it is requested, there's always a possibility that the questions will be different. But we decided to go with what we had last. So we have updated our plan. It's, I think, 8 pages, and it's a bit on the dense side. And we have actually touched on many of the areas already. So I think we'll kind of skim a little bit, and if anyone would like more detail or have questions, then just kind of stop us along the way. Also, this is a possible action item because it is supposed to be voted on by the council, and we welcome any input that anyone has. So we start with our mission, which I will read the first paragraph here. The mission of the Washoe County School District Family Resource Center is to strengthen families by improving access to needed resources and building a network of support to increase overall family stability. And then our vision is that all families are connected with resources and opportunities that promote healthy lives and strong communities. The FRC operates under the guiding principles that families who have support reach their goals and strengthen their resiliency as a family unit. Students learn better when their families are involved, and children flourish in a safe, healthy families and communities. So I think that's a really good summary of what we do and what we're all about. Then we talk about how the FRC is part of the Washoe County School District Intervention Department, which includes children in transition, truancy, foster care, attendance, and the re-engagement program, and how we all work very closely together to support probably the most vulnerable families within the district and the community. We talk about our 5 sites, which I think everybody is pretty familiar with by now, but our Central Reno site at Wooster, our Sun Valley location at Desert Skies, Sparks FRC at Sparks High School, Feemster located at Hug, and North Valley's FRC at O'Brien. So the first question is, what other services are housed in the Family Resource Center? So this has shifted over the years as far as what other programs have been located within the Family Resource Center. And even though some of those programs are no longer physically housed with us, I think that we've touched on our partnerships with programs such as welfare and the food bank, and how our funding sources just really allow us to connect with a lot of different programs. We're intake sites for the State of Nevada Energy Assistance Program, as we talked about earlier, as well as in the Energy Safe program. At the North Valleys, they have a clothes closet in partnership with Good Shepherd and Project 150. At our Central Reno site, they are co-located with our district pre-K program, as well as Community Services Agency Head Start. And new at Sparks, we're hosting an adult ESL program in partnership with Northern Nevada Literacy Council. So what we don't have on site, we still find different ways to partner with many different agencies. Do you want to switch with another, or should I just keep going and then switch?
I can take this one. So we don't want to put anybody to sleep, so we will just kind of skim through these. So the second question is that the NRS, I think most people know that we actually are in the NRS statutes. There are 21 family resource centers statewide. We're the only ones that are co-located within schools. So, which is really important when we're addressing funders, and also just with the vision of what's else is going on in the state. So we're required to provide certain services or have the capability of linking at-risk families with these services. So this is just a list of the services that are provided. Once again, the NRS statutes say that we will exist. They say that we will serve anybody in the community. Not every program is available to every person because of income variations. What they do not include in our NRS statutes is how we will fund it all. So, but that's question 2. I'll give Lisa a break and I'll take question 3. And then, describe how your services are tailored to meet the needs of the community. NRS statutes state that we will be in at-risk neighborhoods. So, and then we are constantly moving and flowing as we put in the new resource centers. All 5 sites do have bilingual staff. The food bank does come to us. Jessie has done an amazing job of making her site accessible to families that maybe otherwise couldn't make it to downtown. So that's how we make sure that our services are tailored to meet the needs of the community. You want to take 4?
Just to add also, as far as families that speak languages other than Spanish, we have been able to tap into the school districts and have translators, which has worked very nice for other languages. So thankful to have that as a resource for our families. Community outreach events, I think you just heard a lot about that, which, by the way, I had to shrink that font and the margins to get all that on one page. So we have been busy. I don't think there's anything here that you didn't just hear in the list that Jessie shared with you. So I'm going to move on to number 5, which actually is kind of similar when we talk about collaborating with other agencies, which as we have said many times, there's no way that we could do the job that we do and serve the families the way we do without our community partners. So again, here's a list of some of the agencies that we partner with. And I don't think actually that listed here is our partnership with all of the Medicaid MCOs, which is just extremely valuable. Yesterday, we had someone from Health Plan of Nevada at our office meeting with, I think, 4 different clients that we had scheduled for him to meet with, which is really intensive needs that he was able to provide a lot of support and resources. So very thankful for that.
And Lisa, for the community that's listening to us, can you tell us what MCOs are and how they cooperate with
Certainly.
Medicaid?
Yes. So MCO stands for Managed Care Organization. And for people who receive Medicaid benefits, they're able to pick between the 4 MCOs of Health Plan of Nevada, Molina, Anthem, and Silver Summit. And we have established relationships with all of them. It's a very valuable partnership for us, which has led to some funding opportunities, which has been great, as well as just a really wonderful resource for our families.
And if I remember correctly, not to go off topic, but one of the MCOs, if not more, has provided some funding for a food pantry at one of our sites.
Yes, we have. So I know Health Plan of Nevada has provided funding. Molina has provided funding. All of them out at North Valleys.
Awesome. So all 4 MCOs and the dental plan for Medicaid.
Yes.
And we have food pantry sites at all sites,
Yes.
all 5 centers, or
Yes.
just? Awesome.
Yes. We all have food. We all have hygiene.
Good job leveraging those connections.
Yes. Thank you. Do you want to take 6? Do you want me to take 6?
Okay, I'm going to do 6, 7, and 8. So these are kind of your standard questions about asking if what needs, what technical assistance, what training needs. So 6 is describe your agency's activities, programs that are targeted for improvement. We're always targeted for improvement, and we're always restructuring. The other way to put that is we jump from lily pad to lily pad as we're putting out the fires. So we have been blessed to have 2 new family resource centers, which then presented its own challenges because of access and all of that. So we are constantly improving and restructuring, and we will continue to do so. Reference in this paragraph, number 6, it talks about call rail. We were first on board, I think, in the state to really embrace it. And Wiley could talk more about that, and will in a different meeting. The eLogic database and call rail have changed our business model dramatically. Part of that I can thank, that's not the right word, COVID for. When the world shut down, we still needed to get a hold of our clients. And so we were able to use a call rail call system so that our clients can now text us through the app. And then, because as you know, younger folks don't ever want to talk on the phone. So we've pivoted through that. We're able to get families the needs so that's how we're restructuring for improvement. Technical assistance, question 7 and question 8, what are our training needs? So we're always looking for training, always looking for conferences or, how to do something better, faster, stronger. So, and then I'll let Lisa take 9 and 10. Thank you. Unless you have questions, Chair.
I do not.
So, am I on 8? I'm on 9. I'm on 9.
9.
Okay. So as far as strategic plans, we actually reviewed our strategic plan at our last meeting, and we will continue to review that and continue to be working on those goals, as well as to be a part of the Washoe County School District strategic plan. And then number 10, I think we're all familiar with who is on our council, and we'll actually be talking a little bit later about some vacancies that are going to be coming up there. Let's see, okay, so this is an old question that I have a feeling if they were to ask us for another action plan might not be on here, but you might remember several years ago there was a wave of looking at could the FRCs try to leverage funds through Medicaid by billing for our services? And a lot of time and energy went into that, and it looks like due to the licensing requirements for staff and things like that, that's not really an option for us at this time. I don't know if that's anything that might come down the road again, or Rochelle, if you have anything to add to that, but.
No, it's been a little bit since we talked to Medicaid, but you do have to be a licensed individual, like a licensed social worker. And so Lisa and I are licensed social workers, but we don't have the bandwidth and capacity to build Medicaid at this time. We would have to look at a different job description structure and the funding that goes along with that if we were going to look into that further. So we don't have the ability right now to do that.
And that's the 1915 I waiver?
Yes.
And the capacity to bill is probably more challenging than it appears to
Correct.
to just me.
Yeah, we were originally looking at trying to bill for targeted case management. There's also, as you know, Chair Benton, specific populations that you can bill for and tracking those specific populations that you're providing targeted case management for.
Thank you for sharing that.
I'll move on to number 12, our collaborations with the federally qualified healthcare centers. So this would be Community Health Alliance and the Hopes Clinic, which are truly blessings to our community. We refer many of our families there, help them get established, collaborate with the staff at the clinics so we can help the clients meet their needs and goals. Couldn't imagine doing this job without them. And I was going to say something else about that is now escaping me. But yes, we do work very closely with both of those clinics. And then as far, was there a question?
Is there a comment?
Sorry, if I could interrupt, but I'm so sorry.
Please.
When you talked about the working relationship, sorry, for the record, this is Rachel Kingham. Is there an opportunity to work through either of those with their case managers? And I don't actually know the legality of all of that, but is there a possibility to work through their case managers with the previous item, which was about Medicaid, Medicare?
I'm sorry, Rachel, who are you referring to? I couldn't multitask. I was trying to get back over so we could see you. Who are you referring to?
Oh,
Yeah, the
so
Medicaid billing,
number
but
12,
whose case managers are you referring to?
CHA and Hopes.
through Community Health Alliance or Northern Nevada Hopes?
That's a possibility that we could look into. With those two particular ones, we don't have any formalized MOUs in place with them. We refer to them. So we could have those conversations further just to explore what that could potentially look like.
I'm not even sure, how the legality of it works, but just kind of throwing it out there. Thank you so much.
Yeah, I mean, it is an idea. At one point during COVID, we had community health workers. Is that what their job descriptions were through the health department? That were co-located within the family resource centers to support families and individuals impacted by COVID. And so that is a model that we could potentially explore in the future. So we've done a version, and we could incorporate Medicaid potentially through some conversations to see how we could partner with them. So thank you for suggesting that.
Thank you.
Okay, and then I'll take number 13 before turning it back over to Brenda. Some of the evidence-based or informed practice models that we use at the Family Resource Center are motivational interviewing, the brokerage model, and strength-based models, as well as adhering to family support practices for family resource centers.
So question 14 is just about our hours. We do try to post hours, but like when we're out doing outreach or if we're doing home visits, then there's a sign on the door. It doesn't say gone fishing, but there's a sign on the door because we can't always be there. Question 15, other secured grant pending. So our biggest grant is the FRC/FHN grant that we wrote this action plan for. So that one's not listed here because that's what it's addressing. So, and I think that's all of our grants. We also do have a private foundation. We have a gifts and donations account, and then we do have our NV Energy and EAP funding as well. But those are not like government grants. So I'll take 16 as well. So describe your community needs assessments. We don't conduct our own community needs assessment because there are other agencies that do it, well-funded community needs assessment. We do conduct surveys. We have Google surveys, and we actually do parenting surveys, pre and post for every parenting class that we do. And then we access the Washoe County, the health needs assessment, community health improvement plan. We are on the family stability grant plan that is always doing needs assessment in preparation for a grant that we're always hoping to apply for. So the full report of the community health needs assessment, there's a link there. And then A, B, C, D, E, F on the bottom of that is obviously all part of that community needs assessment. So there's the formal one, and then there's what happens when our clients just walk in the door and tell us what they need. So, and we are, we address it at a multi-level. We address the formal, but then we are literally in the trenches trying to find size 16 shoes or lice kits and quarters for a home visit. So, you want to take the last one?
Sure. So describe how the FRC activities are addressing the outreach and action plan. So again, I think we can refer back to the many outreach events that we participate in and the many collaborations that we have with other agencies to make all of this happen. And thank you for going through that with us, and we welcome any input or suggestions.
All right. Council, is there any questions, comments for either Lisa or Brenda on the strategic plan?
Oh, I do have a question.
Sure, go for it.
Hi, this is Sherry Alcano. Is there a way for us, okay, so is this something that we can get a copy of at all?
Thanks, Sherry. This is Lisa for the record, and it should be on board docs. So in one of the many, I apologize, emails that has gone out this week, there's a link to the board docs website that has all of the handouts that we've been reviewing today. And if you can't find it there, please email me and I'll just send you the PDF, as well as anybody else that might have a hard time accessing it.
Oh, yeah,
Thank
okay,
you.
thanks.
Great question. Any other
And
questions?
I'm way impressed. You guys did a great job on that. It's just so impressive what the FRC has been doing and how much things have changed and grown over the last few years. It's just incredible. You guys are incredible.
Thank you for that,
Absolutely.
Sherry. We appreciate your support.
Awesome. Yes, thank you. Thank you for getting this to us and presenting us a well thought out action plan. I called it a strategic plan, it's an action plan. As a council, it's an item for action. Is there any, do you want us to formally approve the document, Lisa, or are you just, what are you looking for from the council?
Lisa Guzman for the record. If the council feels ready to approve, then by all means, we welcome you to do that. If you would like further discussion or anything else, we can certainly do that. So whatever suits the council is good with us.
So off
I'm
the
good to
cuff, what
vote.
I would like to see before we formalize and approve this is including all of the grants that we've been awarded. So maybe we can update it and then approve it at our next meeting, just so it's all captured in one area. And then selfishly, our member list is going to change. So maybe, I guess I will make a motion that we allow the staff to make some corrections and updates to the action plan, including the grants and member list changes as appropriate. That is my motion.
I'll second that. This is Rachel for the record.
Thank you, Rachel. Is there any public comment on this item, Rochelle?
There's not.
Okay. So we have a motion and a second. Is there any discussion from the council? All right. All those in favor, please signify by saying aye.
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 Any opposed?
Aye.
All right, motion carries unanimously. With that, I will close item 2.04 and move on to 2.05, which is review of meeting dates of the Council on Family Resource Centers for the 2023-2024 school year. Listed here is September 20th, 2023, January 17th, 2024, March 20th, 2024, and June 20th of 2025. It looks like that a Thursday meeting is asterisked for the June meeting due to the holiday that is observed on that Wednesday. And I think it's also fair for us to talk about the importance of attending meetings, as you guys saw some frantic emails today from Lisa about meeting quorum. So I just want to make sure that these dates, I mean, it's not an action item, but these dates are publicly noticed so that we all have the ability to attend. And then also, I'm going to work with school district staff and then Rochelle and her team to try to fill some of these vacancies. So shameless plug, if you know anybody who's looking for some volunteer work and who has some time, we would love to have some 3 new members. Ideally, anybody involved in the community, but parents is who the council is really built for. Is we meet 4 times for, I think this has been one of our longest meetings. But the time commitment is not a big one, but just making sure that everybody's able to make that time commitment, those 4 meetings a year. And then also referring some of your friends that might be interested in seeing what the Family Resource Centers and the school district do. I think this is a good avenue to getting people involved. All right.
I have a question, Rebecca,
Yes.
for the record.
Yes, Rebecca.
Are we losing people or are we adding 3 more people?
No, we've had a few people resign, And so we have 3 vacancies, and to be able to officially meet, we have to meet quorum. So we have to have 4 people in attendance. If we only had 3 of you come today, then we wouldn't have been able to move forward with the meeting. So I think that's why Chair Benton was talking about the importance of attendance. And then we will now have 3 vacancies as of July 1.
And it's a
Okay,
7-person council. So if we have 3 vacancies, if we don't fill those vacancies before September, all 4 of the people that are on the council will have to be here. And one of them has to be, sadly, Susan Seifert is coming to an end of her time with us, so we do need to have an elected official on the council. That is part of the bylaws and part of the statute that governs Family Resource Center. So if you know any friends that are elected officials, put the shameless plug out there.
I do.
And sadly, I have 2 amazing trustees in the audience tonight. Neither one of them can serve, and neither can any of the other trustees. Even though they are elected officials, they cannot serve on a council or board that reports to them or the superintendent. Or else I would have called each one of them and asked. It was a very good question.
Scott, to that point, as far as elected officials, what are the limitations? Just no one associated with Washoe County School District?
Yeah, it's pretty vague. The NRS just says elected official. So, yeah, I think the Board of Trustees for the school district have certain rules that I'm not completely familiar with that don't allow them to be on these subcommittees, that, as far as I know, unless I'm wrong. But it's very vague, elected official.
Being that this is not an action item, can we maybe look into that and see, since it's the Family Resource Centers and they aren't really governed by the school district?
Yeah.
And
Yes.
just explore it a little. I mean, I don't want to give you direction, but just a food for thought.
Yeah, it would be good to know the ins and outs of
Yeah.
what that really means, so we can do that. And may I say thank you, Sherry, for your time on the board. It's your feedback and your questions and your what you've provided for us has been incredibly valuable, and we will miss you.
Oh, thank you so much. I'll miss the board too. Maybe in a couple of years, I'll be able to come back on if there's another opening. I do have one question in regards to the openings that you have, and in regards to what you said, if we knew of anybody. I do know an elected official, Mariluz Garcia, who might have some interest in it. What can I say to her as far as how she would go forward with looking into if this would be a good fit for her for a volunteer activity?
Sure,
Will you be having these? Yeah, go ahead. Sorry.
Yeah, so you can get on our district website. I think you click on trustees and you click on committees, and that will initially give you some general information about this subcommittee. There's several committees under our board of trustees, so that she can click on the Council for Family Resource Centers and get some general information. If she has additional questions, she can reach out by phone or by email, so we can let her know how often we meet and what do the bylaws look like, what's the purpose of our committee, those kinds of things. But in general, those things are on our website, and she can also view old meetings and old agendas and minutes. They're also recorded, so she can listen in on those. So she wants to get a sense of what a meeting looks like.
Okay, thank you.
And Sherry, I am going to echo Rochelle's sentiments. I am sad to have started this journey when you were on the council, and I hope that I can make you proud as I continue to carry
Oh
your
my
torch.
goodness. You're amazing. Are you kidding me?
Well, thank you.
You do
It's
make
really
me proud.
because you took me under your wing, you and Susan, and I feel like the 3 of us have been on this council forever together, and both you and Susan are leaving and will be dearly missed.
Yes, I will share a little bit of personal, and that is, COVID was really hard for a lot of folks, and mental health issues kind of really went crazy during that time period. And I have an adult son who was specifically very impacted. And so his mental health issues are very serious at this point and over these last couple of years, which is why I've been kind of a flake. But yeah, so we're working really hard to try to get to the place where there's more stability in our sons' lives and then thus in our lives. So that is, it's sad for me to have to leave the council, but that's what's going on in my life as a personal share. Because I think you need to share these things because too many people try to keep them quiet, and mental health is a really serious issue. They shouldn't be kept quiet.
Well, thank you for sharing, and please don't be a stranger. If you need anything, please reach out. We're all here for you.
Well, thank you. Thank you. And I know this council is rocking it with all the folks that are working on the FRC and then all the fellow council members and you guys, everybody. I'm so proud to have been able to be a member of this council.
Thank you. All right, we are going to close all of item 2 and move into our closing items. Item 3.01 is public comment. Rochelle, is there any public comment?
We do have 2. Trustee Colleen Westlake.
Welcome, Trustee Westlake. Wherever you're comfortable. If you want to sit and talk with us, that's okay too.
Am I loud enough?
You'll have to turn it on so they can hear.
Okay, can you hear me? Okay?
Yes,
Oh,
thank you.
that's right. Sorry. Well, I just, first of all, I wanted to say thank you very much for making me feel like a lazy bum.
Stop it.
I am looking at the amazing, unsurmountable work that you have done. I mean, just this graft alone, these little lines represent individuals that all of you have touched their lives and made significant improvement. And we're only strong in our community as a community. And we need to uplift our community so that we can all be better, so that we can all do better. And I am so completely impressed by all of you for what you are giving back to people that really wouldn't have any other avenues, venues, resources if you weren't there for them. And it's impressive. It's really impressive. I mean, my socks were blown off when I went up to the O'Brien Family Resource Center there, but just hearing the overall, I mean, I think this was the best meeting I possibly could have come to hear about all of the outreach that's been going on, about your action plan, and it's just so overwhelmingly comforting to know that you are out there working in the community. You're not just bystander, hoping and just directing and thinking that, you know, things are going to be okay. I mean, you're actually out there delving into the community and letting people know that you're there for them. And it's amazing. It's amazing. And I thank you from the bottom of my heart. I know we are a stronger community because of you. And thank you.
Thank you for those kind words, Trustee Westlake.
Trustee Diane Nicolette.
Welcome, Vice President.
Thank you.
Nicolette.
Welcome. Ditto from what my colleagues said, and we are here representing all the trustees because your work is very important, and it's important for us to thank you. We recognize that this is a 24/7 endeavor, and we want to thank you. I want to read our promise from our recently adopted at our June 13th Board of Trustees meeting. And I think it's very significant that we recognized as a group of 7 that there's a key word in here that needed to be added. I will read it. We promise we will know every student by name, strength, and need, so they graduate prepared for the future they choose. And we will deliver on this promise in partnership with our families and community. And that is very key, families and our community. And you are making that happen every moment of every day. I want to close with a little bit of a quote from Barbara Bush, former First Lady Barbara Bush, who was a very big proponent of families. She says, "Family means putting your arms around each other and being there." And to that, I just want to end with thank you for being there, all of you. And have a great summer.
Thank you. Any other public comments?
None.
Thank you, Rochelle. With that, I will announce that our next meeting is September 20th, 2023, our last meeting of the year 2023. With that, it is 7:22, and I will adjourn the meeting. Thank you all.
Okay, thank you, everyone. And please, Sherry,
Thank
keep
you.
in
Goodbye,
touch.
everybody.
Okay, bye-bye.
Thank you.
Thank you. Good night.